Kidneys are the most crucial organs in our bodies that act as natural filters to eliminate toxins and waste materials from our blood. They're like two tiny cleansing robots that work around the clock to keep us alive and thriving. But have you ever considered how much strain they endure every single day? From the food we eat to the air we breathe, our hard-working kidneys deal with a lot. While they are durable, sometimes they need a little extra care to stay in good condition. And the most effective way to do that is through natural remedies. In this video, we'll explore the top 12 natural remedies that not only help you preserve kidney health, but also support your overall well-being. And here's something fascinating: our number one remedy, which we'll unveil at the end, is an unexpected yet highly effective way to enhance kidney function. So stay tuned till the end. Number 12. Dandelion Tea. Dandelion is classified as a diuretic herb, and its tea form is often used to support renal and hepatic function. The leaves help stimulate urine production without significantly disrupting electrolyte levels, which is crucial for individuals managing fluid retention, mild edema, or hypertension. Unlike synthetic diuretics, dandelion doesn't deplete potassium as aggressively, though it does contain natural potassium, so dosage matters, especially in advanced kidney disease. The root has prebiotic properties that support gut health, aiding the breakdown of toxins before they reach the kidneys. It also contains taraxasterol and beta-carotene, both of which have antioxidant and anti-inflammatory effects that reduce oxidative stress on the renal system. These compounds help limit the progression of inflammation-induced kidney damage, especially in early-stage conditions. Beyond renal use, dandelion root has been used to support bile flow, making it beneficial for liver detoxification and gallbladder function. It may also mildly influence insulin regulation, improving blood sugar control, indirectly easing strain on the kidneys. However, keep in mind, dandelion tea is not universally safe. Patients with potassium regulation issues, kidney stones, or existing renal impairment should avoid unsupervised intake. Some compounds may also interact with diuretics, lithium, or blood pressure medication. It's not a detox fad, it's pharmacologically active and needs to be treated that way. So, with care, this tea can do a lot. Number 11. Cranberry Juice. Cranberry juice isn't just some trendy health drink. It's one of the few natural options that can actually do pretty good when it comes to protecting your kidneys. What makes it so powerful isn't just the vitamin C. It's the rare presence of proanthocyanidins, which are basically plant compounds that stop bacteria from clinging to the lining of your urinary tract. Now, that's a huge deal, because most kidney infections start small, creeping in through untreated UTIs. Keep that pathway clear, and you're already doing your kidneys a major favor. But let's not box it in as just a kidney juice. Cranberries are also loaded with flavonoids that help lower inflammation across the board, especially in your cardiovascular system. That means better blood flow, lower risk of clogged arteries, and some blood pressure support. It's like a miracle, but in an actual sense. Some research even shows it helps manage oral bacteria, so your teeth and gums benefit too. And let's not forget the digestive perks it offers. It boosts good gut flora without overwhelming your system. Now, there's a warning label here. Most cranberry cocktails are basically sugar bombs. That added sugar does the opposite of what you want. It raises your risk of kidney damage and spikes inflammation. If you're in this for your health, stick with unsweetened, 100% cranberry juice, or go straight to the source and make your own blend at home. In short, if you're sipping cranberry juice smartly, you're not just flushing out your system, you're giving your kidneys backup, your heart protection, and your immune system an edge. It's an all-in-one health package. Number 10. Apple cider vinegar. Apple cider vinegar, or in short ACV, is acidic in nature but produces an alkalizing effect in the body once metabolized. This helps reduce the crystallization of uric acid and calcium oxalate, two major contributors to kidney stone formation. ACV contains acetic acid, which improves calcium absorption and assists in breaking down mineral buildups before they accumulate in the kidneys. It also influences insulin sensitivity and glucose control. For diabetic patients or those with metabolic syndrome, this is significant. Stable blood sugar levels prevent damage to the glomeruli, the filtering units in the kidneys caused by glycation and high circulating glucose. This magic liquid may reduce fasting blood glucose when taken consistently in a diluted form. It also acts as a mild antimicrobial agent and can inhibit certain types of bacteria in the digestive tract, reducing the risk of secondary infections that can reach the urinary tract. Aside from all those perks, it supports digestion by increasing gastric acid secretion, which aids in nutrient absorption and prevents overload of metabolic waste. Use of ACV must be cautious and always diluted. Consuming it undiluted can cause enamel erosion, esophageal irritation, and long-term damage to the stomach lining. 1 tablespoon in a full glass of water once per day is typically sufficient for therapeutic effect. But remember, it is not suitable for individuals with chronic kidney disease without medical supervision due to potential shifts in pH and potassium balance. Number 9. Garlic. Well, it can make your breath stink, but it's a Superman for your kidneys. Garlic contains the sulfur compound allicin, which exhibits antimicrobial, antioxidant, and antihypertensive properties, all of which directly support kidney health. Allicin reduces oxidative stress by neutralizing free radicals that cause structural damage to renal tissues, particularly in patients with chronic inflammation or elevated blood pressure. Garlic's blood pressure lowering effect comes from its ability to increase nitric oxide availability, which dilates blood vessels and lowers vascular resistance. Since kidneys rely on steady controlled blood flow, this improves filtration efficiency and helps prevent glomerular damage. It also reduces LDL cholesterol and inhibits platelet aggregation, supporting cardiovascular function and indirectly preserving renal integrity by reducing strain on the vascular system. For diabetic patients, garlic may slightly lower fasting glucose and reduce the formation of advanced glycation end products, which are harmful to kidney tissues. Plus, garlic's detoxification role should not be overlooked. It boosts enzyme activity in the liver and also assists in chelating heavy metals, such as lead and cadmium, substances that, if left unchecked, tend to accumulate in the kidneys. Raw garlic offers the strongest therapeutic effect, though aged garlic extract is better tolerated and retains its core benefits. However, excessive intake can interact with anticoagulants and certain blood pressure medications and may irritate the stomach lining if consumed in large doses. In clinical nutrition, garlic isn't seasoning, it's intervention. Number 8. Turmeric. Turmeric isn't some trendy yellow dust to toss on lattes. It's a centuries-old medicinal root that hits inflammation where it hurts. Inside it is curcumin, and curcumin doesn't mess around. This compound fights systemic inflammation at the cellular level, which matters because inflammation is the slow, quiet killer behind most kidney problems. And while your kidneys filter the blood, curcumin protects the filters from corroding in the first place. That's only part of what it does. Turmeric stabilizes blood sugar, not like a gimmick but like a metabolic buffer that actually improves insulin sensitivity. For anyone with diabetes or borderline sugar levels, this is essential. Elevated glucose damages tiny blood vessels in the kidneys over time. Keep that in check, and you extend your kidney's shelf life. On the cardiovascular side, turmeric lowers oxidative stress, improves circulation, and helps keep blood pressure under control, all critical for keeping the kidneys from being overworked. It also supports liver detox, gut balance, and even cognitive function in the long run. You don't need to overdose. A teaspoon in real food with black pepper for absorption is enough. Turmeric works best when it's part of your plate, not some overpriced capsule. It's not flashy. It's not sweet. It's just effective, and it's been doing the job long before anyone decided to rebrand it as a superfood. So go for the natural one and ditch those tablets. Number 7. Olive oil. Olive oil isn't just a kitchen staple, it's clinical nutrition bottled in green glass. Specifically, extra virgin olive oil contains high levels of oleic acid, a monounsaturated fat with strong anti-inflammatory properties. Chronic inflammation is one of the key underlying causes of kidney decline, especially in people with hypertension or metabolic syndrome. By reducing systemic inflammation, olive oil helps shield the kidneys from long-term oxidative damage. Then there are polyphenols, plant-based antioxidants found abundantly in high-quality olive oil. These compounds help neutralize free radicals, reduce oxidative stress in renal tissues, and may even slow the progression of chronic kidney disease. And unlike seed oils, which often trigger inflammation when consumed in excess, olive oil stabilizes lipid profiles by lowering bad cholesterol and raising good cholesterol. Olive oil also supports cardiovascular integrity, improves endothelial function, and plays a protective role in insulin regulation, vital for patients managing diabetes or blood pressure. It also promotes brain health, thanks to its role in reducing beta-amyloid plaque formation. Use cold-pressed, extra virgin olive oil raw when possible on salads, dips, or post-cooking to preserve its nutritional value. And always check the source. Real olive oil should sting slightly in the throat from the polyphenols. Number 6. Grapes. Red and purple grapes carry more weight than their size suggests. These small fruits are loaded with flavonoids, particularly anthocyanins, which help protect kidney cells from oxidative damage. But what sets grapes apart is their high concentration of resveratrol, a polyphenol that reduces inflammation, improves endothelial function, and helps regulate uric acid levels, critical in preventing kidney strain and crystal formation. Resveratrol also activates a gene known as SIRT1, which plays a role in mitochondrial protection and metabolic regulation. That means grapes don't just support the kidneys, they help protect your body at the cellular level. In some animal studies, resveratrol has even been shown to delay the progression of kidney disease by improving filtration rate and reducing protein leakage. The hydration factor adds another layer. Grapes are 80% water, so eating a handful contributes to fluid intake, aiding in toxin removal and reducing the workload on the kidneys. Their natural sugars don't spike blood glucose as aggressively as refined carbs, making them a safer snack for people watching their blood sugar. Grapes are beneficial for cognitive health, circulation, and skin elasticity, thanks to their broad antioxidant profile. Just don't go overboard. Too many can mean too much potassium for those with impaired kidney function. Stick to whole grapes, not juice, to keep the fiber intact. Eat them fresh, cold, or frozen. Just don't underestimate them. These aren't candy, they're therapy. Number 5. Watermelon. Watermelon is more than just hydration in fruit form. It's a strategic food for renal support. Composed of over 90% water, it helps increase urine output, assisting the kidneys in flushing out toxins and reducing the risk of crystal or stone formation. But it's not just the water content that matters. Watermelon contains citrulline, an amino acid that boosts nitric oxide production, helping blood vessels dilate and easing pressure on the kidneys. Then there's lycopene, a powerful antioxidant concentrated in red-fleshed fruits. In watermelon, lycopene helps reduce oxidative stress in renal tissues and has been linked to a lower risk of cardiovascular disease and prostate cancer. Vitamin C and beta-carotene also contribute, offering anti-inflammatory support that indirectly protects kidney cells from gradual wear and tear. Because it's naturally low in sodium and phosphorus, watermelon is kidney-friendly for most people, especially those managing early-stage kidney conditions. Its mild diuretic effect doesn't shock the system like caffeine or alcohol-based diuretics, making it safer for long-term use. Watermelon also supports digestive health, improves skin hydration, and may assist in muscle recovery due to its electrolyte content. And while it's a fruit, its glycemic load is relatively low when eaten in moderation. Number 4. Cabbage. Cabbage might look humble, but it's biochemically loaded. This cruciferous vegetable is rich in compounds like sulforaphane and indole-3 micoscarbonyl, both of which support detoxification at the cellular level. These molecules help neutralize free radicals and may even assist in breaking down harmful byproducts before they reach the kidneys. Low in potassium and sodium, it is an ideal food for people with kidney disease, especially in later stages where electrolyte control becomes critical. Its fiber content supports digestion and waste elimination, easing the burden on the kidneys by helping the body excrete toxins through the intestines instead of relying entirely on renal filtration. Vitamins K, C, and B6 add another layer of support. Vitamin C helps reduce systemic inflammation, vitamin K supports vascular health, and B6 contributes to metabolic stability, all factors that ultimately tie back into kidney protection. Cabbage may also have anti-diabetic effects by improving insulin sensitivity and glucose metabolism. And for the cardiovascular system, its cholesterol-lowering effects add further protection since heart health and kidney health are tightly connected. Fermented cabbage like sauerkraut adds probiotic benefits, but mind the sodium content. For most lightly steamed or raw cabbage offers the best balance of nutrients. It's cheap, accessible, and medically relevant. Not trendy, just smart. Number 3. Parsley. Parsley is probably the best thing you'd expect to see topping this list, but it earns that spot without any hype. This common herb, often left on the edge of your plate, is a pharmacologically active plant with very real measurable benefits for your kidneys. It's rich in vitamin A, which supports tissue repair and immune function. Vitamin C adds antioxidant protection, and vitamin K helps regulate calcium in the blood, which indirectly helps prevent mineral deposits in the kidneys. But the real strength of parsley lies in its diuretic properties. Compounds like apiol and myristicin stimulate urine production, helping flush out toxins, excess sodium, and waste without depleting electrolytes the way pharmaceutical diuretics often do. That function alone makes it valuable for people managing fluid retention, mild high blood pressure, or detox overload. It also contains chlorophyll and flavonoids like luteolin, which have anti-inflammatory effects on the kidneys and surrounding tissues. In animal studies, parsley extract has even shown the ability to inhibit the formation of kidney stones, particularly calcium oxalate types. It's been studied for its ability to reduce nephrotoxicity from drugs like gentamicin, offering another layer of protection. Raw parsley is ideal, freshly chopped into salads, smoothies, or grain bowls. You can also steep the leaves in hot water to make a medicinal tea. It's cheap, accessible, and doesn't need fancy marketing to prove its worth. It's not garnish, it's a botanical tool. The only mistake is ignoring it because it looks small. Alright guys, now let's talk about something special. Number 2. Good old water. Water isn't exciting, it doesn't taste like much, it won't win awards for innovation, but if we're talking about kidney health, it's the first thing that should be on your list. Your kidneys are filtration organs. They need a steady flow of liquid to do their job, and nothing provides that better than plain, clean water. When you're underhydrated, your kidneys are forced to work harder to concentrate urine, reabsorb fluids, and manage waste, all of which puts stress on the nephrons, the tiny filtering units inside. Consistent water intake keeps things moving. It dilutes minerals like calcium, oxalate, and uric acid, making it less likely for kidney stones to form. It also lowers the risk of urinary tract infections by flushing out bacteria before they have a chance to settle and multiply. For those with a history of infections or early-stage kidney disease, that daily hydration isn't optional, it's protection, and it goes beyond kidneys. Adequate hydration supports blood pressure regulation, prevents fatigue, helps control body temperature, and keeps your digestion and metabolism running smoothly. It even impacts brain function and mood stability. Yet, most people either don't drink enough or replace water with sugar-loaded drinks that only strain the kidneys more. There's no secret formula here, just consistency. Most healthy people should aim for 8 to 10 glasses per day, more if active or in hot climates. The goal isn't overhydration, it's balance. Pale yellow urine is your best guide. Simple, quiet, effective. That's what water does best. Number 1. Red bell peppers. Red bell peppers aren't just colorful, they're nutritionally strategic. Of all the bell pepper varieties, the red ones are the most mature and contain the highest levels of essential vitamins and antioxidants. They're especially rich in vitamin C, which supports immune response and reduces inflammation, a foundational issue in chronic kidney damage. They're also high in vitamin A and beta-carotene, nutrients that protect against cellular damage and oxidative stress in kidney tissue. One unique compound, lycopene, adds another layer of defense by inhibiting the inflammation pathways that often drive kidney disease. Lycopene is also studied for its role in cancer prevention, particularly prostate and lung cancers. Red bell peppers are low in potassium and phosphorus, making them a safe choice for people with kidney disease, unlike many vegetables that are off-limits due to their high mineral content. Their fiber content supports digestion and metabolic regulation, helping reduce blood sugar spikes and cholesterol, both of which can harm kidney function if uncontrolled. They also contain B6 and folate, which support red blood cell production and reduce levels of homocysteine, a compound associated with cardiovascular and renal risk. Whether roasted, raw, or sautéed, red bell peppers provide high reward for low renal cost. They're not just a garnish, they're a full-spectrum, nutrient-dense asset to your diet. If you found this video helpful in any way, be sure to like it, share it, and hit the subscribe button for more content like this. Thanks for joining us, and we'll see you soon.